As an autistic person, do you have problems with your immune system? Have you even thought about how your immune system affects your autism? These are some important questions to ask that usually aren't asked by your doctor when dealing with your autism. Because a lot of the times the doctors are just looking at your behavior, your outward behavior towards society, and they are not looking at it and addressing it as an internal brain disorder. A lot of the times they're looking at it, you get an ABA therapist, which is teaching you how to behave correctly. You're looking at somebody helping you with doing CBT, which is cognitive behavioral therapy. So they're teaching you how to deal with your triggers and how to think before you act and how to work on your triggers and develop better social responses to the general audience that you're dealing with every day, day in, day out. You also may have a counselor who specializes in what's called DBT, which is basically it's like Zen Buddhism, but they can charge insurance for it, and they're not talking about anybody's religion. They're just talking about the practicalities of the behavioral therapy that they're doing. But the problem is that they're not addressing one of the fundamental problems that happens with a lot of people experiencing autism, which is autoimmune disorders, allergies, um, gut problems, and overall not brain abnormalities that could possibly have happened while they were gestating in their mother's womb. Unfortunately, we can't blame our mothers for everything. So, once we're born, we have to take care of our own responsibilities as living beings. While we're minors, our parents are supposed to be in charge of us, but they're only doing the best that they can. And if your mother had an infection while she was gestating you in her womb, and you are autistic, that infection could have led to an increase in auto antibodies that could be causing a lot of the problems associated with your autism. So there's this paper. It's a very thick paper. I tried dealing with it and tried doing a video on it, and it took me 45 minutes to go in depth on it, and I was only halfway done. So this is a very important paper. I'm gonna chunk it down, maybe put it together as part of a 10-part series or something like that in the future. But right now, I just want to deal with what's called an abstract. That's like the best of the meat of the article. And so the abstract. Autism is a neurodevelopmental disorder characterized by deficits in communication and social skills, as well as repetitive and stereotypical behaviors. While much effort is focused on the identification of genes, human genes associated with autism, research is emerging within the past 2 decades, suggesting that immune dysfunction is a viable risk factor contributing to the neurodevelopmental deficits observed in autism spectrum disorder. Further, the heterogeneity within this disorder has been brought to light. Much of the current thinking regards the subphenotypes within autism and how the immune system is associated with these distinctions. So, what the hell does that mean? So, immune dysfunction is a viable risk factor to the neurodevelopmental deficits observed by autism spectrum disorder. So, genes and immune dysfunction can cause a lot of problems. Common sense points out that when somebody's immune system is not working well, they got a cold, they have the flu, they have gastric problems, they have inflammation, they're not going to be feeling all that well, and then that's going to affect their behaviors. So, if you have allergies, if you have gut disorders, if you have diarrhea or constipation or a lot of inflammation that causes you to have achy joints, achy bodies, and an achy mind, and bad attitude towards society, and then you lash out at society, those are contributing factors. And no matter how much behavioral therapy you're going to be getting, if you're physically sick, that behavioral therapy is only going to do so much. So taking care of your immune system and getting your immune system balanced is one of the most important things you can actually do. One of the things that I experienced for my life was for roughly 30 years, I was sick just about every single day. I had either the sniffles, I had some sort of nasal infection, I had achy joints, I had a lot of inflammation, I had lots of problems with my lungs, my circulatory system, uh, you know, cough, unexplained and just dry cough that wouldn't go away for months on end, sniffles that would just attack me. Just even living in Southern California and in a nice dry climate, it still didn't help because my immune system was all messed up, and it was making me feel horrible. And I was lashing out at people, and that wasn't helping my social aspects of my life. I was getting through it, and I had to learn how to mask. I had to learn how to fake it until you make it, and I did what I had to do in order to get through it. But so one of the things that they're noticing is with this paper, they're talking about that during gestation, prenatal insults, including maternal infection and subsequent immunological activation, may increase the risk of autism in the child. So you may have, you know, unbeknownst to you, your mother may have had a hard pregnancy and she may have been sick. She may have had allergies herself, food allergies or environmental allergies, and this inflammation could have affected you and the way your brain works, way your brain developed, the way your immune system developed. And if you developed in a hostile environment, you may have had to deal with a hostile attitude towards life. And it says that similarly, the presence of maternally derived anti brain autoantibodies found in 20% of mothers are at risk for developing so whose children are at risk for developing autism has defined an additional subtype of autism. The postnatal environment, on the other hand, is characterized by related but distinct profiles in immune dysregulation, inflammation, endogenous autoantibodies that persist within the affected individual. Further definition of the role of immune dysregulation in autism thus necessitates a deeper understanding of the interaction between both maternal and the child's immune systems and the role they have in diagnosis and treatment. So the bottom line is that um, unfortunately, we can't do anything about how our mother's health was when we were born, but at the same time, if you've never asked about how how your mother's pregnancy went, you may want to ask just to know a little bit more history about what's going on. There's no point in blaming her for causing your autism, because the bottom line is it doesn't matter, because what's done is done. What you can do now is figure out how to deal with your immune system, how to bring down the inflammation, how to deal with feeling better, figuring out what foods you're sensitive to, figuring out what things in your environment that you're sensitive to, and at first eliminate those things as much as possible. And then, secondly, look at dietary supplements and how they interact with your body, and whether they can work for you or not. There are a lot of dietary supplements that I use myself. I'm not here to push any products on anybody. Um, and I used to do sales in dietary supplements. Did that for like 20 years before I got into psychology. So the realization is that there's a lot of things out there that can help, but there are no miracle pills. There is nothing that you can take that's automatically going to cure you of whatever you got. It doesn't matter what you got, it ain't going to do it. You have to put in the work, and you have to work on cooperating with these different types of concentrated foods that are put in a pill form. But at the same time, you got to look at how you eat, how often you eat, how often you sleep, how often you exercise. If you exercise too much, too little, you just got to find the Goldilocks and become Goldilocks, and live the middle road, just like Buddha talked about. And then you can get back into balance, and you can live the life you want to live. So I'm going to leave it at that, because I'm going to go more in depth with this paper. I'll put a link to it, but it's very deep. It's going to take you hours to read and understand. So, but if you really want to know about your immune system, this is the paper, this is the link to look at. And so, like I said, this is Dan. This is finding your hidden superpower. If you don't have a healthy body, there's no way you can have a healthy mind. So work together with your mind, with your body. You're all one person, and everything is connected. So try and put it together, try and figure out what your challenges are, and try and deal with them as best you can. And that's why I'm here, because I've been able to do it, and I was doing it out of desperation. You don't have to do it out of desperation. You can listen to people on YouTube and find the people that you most relate to, and I hope I'm one of them. So, with that, this is Finding Your Hidden Superpower, Autism, Asperger's, and those of us who are neurodiverse. Have a great evening.